Good morning, everyone. I would like to call this House Veteran Affairs and Emergency Preparedness Committee public hearing call to order. Okay. At this time, I would like to ask General Weller to please lead us in the Pledge of Allegiance.
I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Oops. Yeah, we lost your folder there.
I got it.
All right. Why don't we first take a couple seconds to go around and introduce the members and the staff that is here today with both committees.
Thank you, Mr. Chairman. Good morning. My name is Jonathan Fritz, representing the 111th District, comprising Wayne and Susquehanna counties.
Good morning, ladies and gentlemen. Representative Don Costa, 21st District, Allegheny County City.
Good morning, everyone. Rick Saccone, representing the 39th District, which represents southern Allegheny County and northern Washington counties.
Morning, Barry Joswiak, 5th District, Berks County.
Mark Gillen, Southern Berks, Northern Lancaster County.
Brian Barbin, Cambria County. I represent Johnstown.
Michael Hillman. I am Democratic Executive Director, House Veterans Affairs.
Representative Chris Sinot. I'm the Democratic Chairman of the House Veteran Affairs and Emergency Preparedness Committee.
Sean Harris, Research Analyst for the Committee on Veterans Affairs.
Good morning. I'm Rick O'Leary, Executive Director for Chairman Barrar.
We're going to skip over you.
Okay.
Erin Robb, Republican, Executive Director of the House Aging Committee.
Pam DeLisio, I represent the 194th, which are parts of Philadelphia and Montgomery counties.
Steve McCarter, Montgomery County, House District 154.
Carol Hill Evans, representing the 95th District in York County.
Martina White, representing Northeast Philadelphia, the 170th District.
Frank Ryan, representing the 101st District in Lebanon, Pennsylvania.
Chris Dush, the 66th District in Jefferson and Indiana counties.
Thank you. I want to thank the staff for sending me the memo on the uniform of the day. I forgot my jacket and tie, so I apologize for being so casual. Good morning. I'm Representative Steve Barrar, Majority Chair of the House Veteran Affairs and Emergency Preparedness Committee. I want to welcome everyone to our joint public hearing with the House Aging and Older Adult Service Committee on the subject of assisting our aging veteran population. We have several expert panels before us today, and I want to thank them for being here. As well, I would like to thank DMVA Commandant Blackwood for hosting us at this beautiful State Veterans Home. We look forward to touring the facility later this afternoon or this morning, whenever we're done. Today is rather landmark in that for the first time since my tenure in the House of Representatives, we have both the House Veteran Affairs and Emergency Preparedness Committee and the House Aging and Older Adult Service Committee joined together to examine the needs of our aging veteran population. I think it's a great opportunity for both committees and the department to get a full picture of current programs and the existing needs of our veteran community and their families, and to strengthen our ability to work together towards a common goal, which is to help residents of our great Commonwealth and to assist them in their time of need. With that, I will now turn over the microphone to Majority Chairman Tim Hennessey for remarks, and then followed by Chairman Chris Sinato, and then Chairman Samuelson. Okay? Tim.
Thank you very much. Good morning, everyone. Welcome to Southeast Veterans Center. Welcome to my district. Let me first say that this has been a pleasure to be here, have Southeast Veterans Center in my district for all these many years. Since 2002, I think, I took over when with redistricting. I had assigned to me East Vincent Township, and with that came the opportunity to sit on the advisory committee here at Southeast Veterans Center as a representative of the Speaker of the House, presently Mike Turzai. and I report back to him in terms of the issues that arise here at Southeast Veterans Center. I will say that it is one of the finest veteran centers in Pennsylvania. We have a very proud history and a proud tradition. We've got a wonderful staff and an administrative staff here at Southeast, and we take fantastic care of our veterans. You're going to see the new facility as part of the tour in a little bit. I had referred to it the Alzheimer's unit. It's really a much broader focus on mental health issues for our veterans here. But it's a building that opened about 5 or 6 years ago. I was under the impression it was costing $30 million. I'm told that by the time it was done, it was closer to maybe $60 million. But it is a fantastic new building and new enterprise here at Southeast Veterans Center. So keep your eyes open, enjoy the tour. You're going to see a very, very fine home here. I appreciate Chairman Barrar agreeing that we do a joint hearing today on aging issues and aging programs as they affect the veteran population. It's a focus that we haven't really put on things specifically before, and we're happy to do that today. And I want to, again, welcome you all here to my district. And those of you who didn't apply for a daily visa, I'm going to waive that obligation today. You don't need that visa to be here in the 26th district. Thank you.
Okay. Chairman Snow.
Thank you, Chairman Barrar, Chairman Hennessey. It is a privilege to be in the 26th District and to be here today. I know our committee toured this, I think, around 6-7 years ago, and where there was things under construction, and we saw things then. So we look forward to that today, look forward to the testimony, and it's just great to see so many of our colleagues participating today. We thank each and every one of you for coming for this important hearing. So thank you.
Thank you, Chairman Sonato. Absolutely, I'd like to thank the members for the great turnout that we have here today amongst both committees here. At this time, I will call up Deputy Commandant Mildred Butler Coleman for some welcoming remarks. Thank you and welcome.
Thank you very much. Welcome on behalf of the Department of Military and Veterans Affairs.
Mildred, do you want to?
Would you take a seat?
Just so you have a microphone.
Thank you very much. On behalf of the Department of Military and Veterans Affairs, we welcome you to the Southeast Veterans Center in beautiful Chester County. We've been serving veterans since 1986. That's when this first building opened, and then we have the newer building that you'll tour in a couple hours if you so desire. We'll be doing tours, but we wanted to let you know that we serve 290 veterans or spouses of veterans. Those are the criteria we have for admission. If you're not a vet, but you're a spouse of a vet, you're welcome to come here. Most of our vets, we have 290 that we are licensed to serve, 50 on a personal care level, which are more independent boarding home level residents, and then we have the balance of 235 or so that are in our skilled nursing area, which is more of a medical assisted kind of unit. After the official hearing, you'll be welcome to stay for lunch, and we'll be serving lunch in our resident mess hall. It's military lingo, and you will be escorted to the dining area where you'll be able to enjoy lunch with the veterans. The personal care guys and gals eat in the Tillman Hall, and you'll be able to have lunch with them, and it will be cafeteria style. So we'll be escorting you down. We'll have you get a tray and join everybody and have lunch. And just so you know, around 11 o'clock, this is a medical facility with regulations, as you well know. We have a fire drill, which will be up on the 4th floor, right above our heads, about 3 floors up. It's just for that unit. If you hear bells ring, it'll be okay. Continue on. Hopefully it won't interfere with the mic or your ability to be able to communicate. But the 4th floor has to do their annual fire drill. It's part of the regulation, and we want to be compliant. So we thank you in advance for your consideration in that particular event. Any questions? I'll be in the area, and you can just grab me, and I'll be happy to assist.
Great.
Thank you,
Thank
sir.
you. Okay. At this time, I call up Major General Eric Weller, who is the Pennsylvania Deputy Adjutant General for Veteran Affairs under the Department of Military and Veteran Affairs. It is a pleasure to have you here with us today, General. And thank you for taking time out of your busy schedule to be with us.
Thank you very much, sir. I appreciate that. I've got my crutch here with me, Mr. Hamp, my special assistant. In case anybody asks any questions above a high school level, he's the guy to answer them. So I'll jump right into it if that's okay. Good morning, committee chairs, committee members. It's a pleasure to be here with you, and I know that you're also fellow advocates of Pennsylvania's 820,000 veterans. I'm really glad that you've allowed me to come here in order to help promote veterans advocacy. I've been on the job for about 21 months. I've obviously had the opportunity to work with a lot of dedicated people in the Office of Veterans Affairs. I've had the honor and privilege of meeting members of all of the various service organizations throughout the state, two of which are represented here today, Mr. Getz from the VFW and Mr. Foster from the American Legion. Again, they're our brothers in arms, and I absolutely appreciate the fact that you are giving them an opportunity to speak today. I've had the opportunity to meet with the State Veterans Commission about once every 2 months, the Pennsylvania War Council about once every 2 months, the county commissioners on a quarterly basis, the county directors for Veterans Affairs or their executive board about every 2 months. I've had the opportunity to meet with a ton of 501(c)(3)s, and if you didn't know it, there's about 6,000 of them out there, and I can't say that I know every one of them, but I'm trying. And then I've also had the opportunity to meet with, obviously, various legislatures such as yourself. I've noticed a lot of collaboration between all of the organizations, and quite frankly, I'm overwhelmed with just trying to get my arms around everybody that is supporting veterans. Our mission as it relates to veterans benefits are to create awareness that benefits exist, to educate people on what those benefits are, and to help provide accessibility to those benefits. And then obviously we have a legislative responsibility to care for our veterans. DMVA, therefore, is basically funded to handle three things. Number one is we do have a benefits program, which we call program services. We run basically grant-type programs for people, blind and paralyzed veterans, amputees, that type of stuff, all through state funding. We also have an outreach program, and then we run or administer 6 veterans homes, all of which I'll talk about in a moment. So what I can do and what I cannot do. Number one, I just want to frame what my job is or what it is not. First of all, I can't afford to discount anybody or dislike anybody. Obviously, everybody has an ego, and my job is to try to get everybody's egos in check and working together with each other, no matter who you are or what organization you're from. I don't write legislation. I don't direct the county directors for Veterans Affairs. I don't direct the county commissioners. I don't direct the veteran service organizations. I don't direct the 501(c)(3)s or other state governments, and sometimes even other agencies within DMVA. But I can interact with all of these people. I can interact and try to get them to work together, as I've alluded. Therefore, messaging is a big part of our, it's one of our highest priorities, sales and messaging, I should say. Some of the priority issues that we're working on now are preserving the Office of Veterans Affairs budget, supporting a regionalization concept, which I'll talk more about in a moment, supporting mental health initiatives to the best that we can, and as you know, we are not funded to support any of them, actually. So we're trying to get creative on what we can do. And then also another priority is to establish outreach into the rural areas for additional capacity for veterans' homes. As you know, we took a significant cut in the 2017-2018 budget, and that prompted a lot of studies. Specifically, it made us look internally, number one, to justify all the manpower that we have. I have about 2,000 employees. Most of them are associated with the state veterans homes, but I can tell you the function of each and every one of them. I can tell you why they exist, either through federal, state, local regulations, industrial standards. I can give you the time measurements, in relation to why I need so many custodians in a building, the whole 9 yards. So I have justified the people that we have. So that question is off the table. Another thing that we've done is taken the time to provide a 5-year plan, mainly to the Governor's Budget Office. And then we also did cost studies. There was a lot of talk about the expense of the state veterans homes. So we took the time to do a cost study, number one, to determine whether or not, compared to the private economy, if we are or are not charging too much money or spending too much money. So what we found is on the skilled care side of the house, we actually cost about $5 less per day per resident. On the private care or personal care side, we're about $20 less per day. And then there was a lot of talk about privatization. And so what we found there was that, again, we're significantly less, on the average about $20 less per day if somebody would go ahead and try to privatize our entire state veterans homes operation. And then we did compare ourselves with other state agencies and that have a similar operation, and actually found that we're running about $100 a day less per resident per day. So, how did we manage last year? It was very easy. I knew what I had to work with. I knew how many employees it would take to manage a certain number of veterans in our state homes, depending on the level of care that they needed. And that's basically how we managed. Less employees means less veterans that we can take care of. More employees, more veterans that we can take care of. The nice thing about it is the Governor's Budget Office has told us, you keep putting veterans in the homes and we'll help you find money. That's very refreshing for us. So this year, in this budget, we fared out fairly well. We did receive at least a cost of living increase, if you will. We also received a $500,000 increase on our Act 66 program. That's a program where we actually fund veteran service officers throughout the state to help veterans file mainly for their federal and sometimes state benefits. Just to give you an idea, that $500,000 takes us up to $2.8 million as far as funding those individuals. We have over 100 of them that we fund, and as far as a return on investment, which a lot of people don't look at, return on investment is roughly $1 invested, $35 comes back into the state, mainly for the veteran, but the first time the veteran spends that dollar and keeps spending, it just has to change hands about 10 times and it becomes total state dollars. So 1 in 35 is fantastic in my opinion. And if I could invest in the program and get that return, I certainly would. As far as our budget, we also received a $100,000 increase for the Civil Air Patrol. That doesn't really have anything to do with the Department of Military and Veterans Affairs. We're more or less a pass-through on that. And then we also received a $750,000 legislative ad for mental health initiatives. Again, that was provided by the legislature. It is directed dollars, if you will, but we've been told if we can manage to get that into our budget and come up with a plan as to how we would help contribute towards dealing with issues such as just mental health issues, PTSD, drug and alcohol issues, TBI, those types of things, that money might start appearing on an annual basis. So that's another focus that we've been looking at. The bottom line is we need your continued support, and thank you for your past support. Some new programs of records that we'd like to establish, or other things that we've been doing over the past year. As I've mentioned, we've been starting to address or come up with a plan on how to look at mental health, drug and alcohol addiction, PTSD, homelessness, suicide prevention. partnerships by expanding the reach of our veterans' homes, and potentials there would be potential county or partnerships with the existing county homes, or the potential of building smaller homes and more veterans' homes in more rural areas, or the one that looks actually most interesting right now is some sort of a partnership with private care facilities, contracting out, perhaps an existing wing in their facility and working with the federal VA to make sure we've got all the right reimbursements in place. And then another initiative that we've got going is a startup for adult health daycare. And actually at this veterans home is where we're going to start our pilot program, and that should hopefully be a reality within the next 2 years. We've already laid the groundwork in case it is a success to establish another adult health daycare facility in Hollidaysburg. Other things that we're looking at as it relates to especially the service organizations and what they're interested in are issues such as aging in place, potential privatization of some aspects of various veterans operations. We spend a lot of time with incarcerated veterans. We do a lot of outreach in the prisons, especially the ones that have the veteran service units. We've been corresponding and are meeting a lot with AOPC as it relates to veterans courts. And quite frankly, we've committed to, once they start expanding their program, and again, they're looking at regionalizing the remaining counties that don't have a veterans court, we've offered assistance in relation to marketing and or helping them stand up mentorship programs for each one of those courts. We're also looking at, with DOC, at post-sentence testing for incarcerated veterans. Through all of this, though, what do I see? And quite frankly, I see a lot of good organizations doing a lot of good things on behalf of veterans. Another thing I see is a lot of good people and organizations doing a lot of good things on behalf of veterans that don't network with each other. So as I've been looking at this, I ask myself the question, does everybody know everything? And the answer is no. And what are some of the keys to success? Number one is to organize, and number two is to educate. Number three would be to provide an information or a forum for information exchange. So as I'm looking at how we're going to move into the future, I keep asking myself the question, am I going to receive more money in my budget? I don't know the answer to that, so I have to take the negative side and say, I probably won't. I'm hoping that I do, but I probably won't. So does that mean that my job ends, though? And I refer back to those issues that I was talking about earlier, the items that I'm not funded to take care of or participate in, all the mental health issues, homelessness, so on and so forth. So, as a result, I keep asking myself, what is out there already that we can tap into? And, quite frankly, the basis for what I think that we need to tap into from our organization is a lot of the premier 501(c)(3)s. And I'll name a few of them in just a moment. But anyway, so we're documenting a plan where we've divided the state into about 5 regions that house at least 2 of these premier organizations in each region. Who better than to know the issues in their region than these 501(c)(3)s? So anyways, I'll just give you an example of some of them. Veterans Leadership Program out of Pittsburgh, Veterans Community Initiatives out of Johnstown, YWCA and out of Harrisburg. I know you're asking yourself, YWCA, what's that got to do with anything? Well, I'll tell you. Veterans Multi-Service Center Philadelphia, Multi-Service Center Central Pennsylvania, Lackawanna Workforce Development Veterans Resource Coalition, an organization called HANDS up in Erie, another organization called COATS up in Erie, another organization near here, Lehigh Valley Military Affairs Council. The bottom line is, what do each one of these organizations have in common? Basically, the basis for each one of those organizations is to deal with homelessness. So, what else do they deal with? And that's my next question. Well, the contributing factor towards homelessness. And that's where we get into all of the other things that we're not funded to deal with here. TBI, PTSD, drug and alcohol issues, lack of employment, so on and so forth. So anyways, all of these organizations are involved in either providing direct or indirect referrals for homeless people that have those types of issues. So yes, I should get my arms around them pretty quick, and that's what I plan on doing. My goal is to provide a forum for all of these organizations, including the county directors, state offices, service organizations, and other 501(c)(3)s to cross-tell. Another goal is to provide a forum for direct interaction between these agencies. Another goal is to find out what all the holes are in each region that I can help plug. The bottom line, though, is I really want to set up an informational network so that if I have, let's say, a county director up in Erie that's got a veteran that has a severe PTSD issue, that he or she knows that there's actually an organization out there that can help them, a 501(c), maybe down in Quakertown, Pennsylvania, or in Lancaster, because that information is just not available in any one spot. So, back to the framework of my job, the bottom line is I don't want to be a figurehead. Talk is cheap, results take effort, and I'm willing to put forth the effort. I'm very grateful for the participation and or support of the legislators, state agencies, the PA War Council, State Veterans Commission, another organization which I chair, the Governor Advisory Council for Veteran Services, which is made up of a lot of state agencies divided into various committees, Aging Committee, Education and Employment Committee, Behavioral Health Committee, Judiciary Committee, Office of Administration Committee, Suicide Prevention Committee. That's where we are able to get a lot of the state agencies together and cross-pollinate. And all I'm really doing is, and when I talk about regionalization, is looking for a way to start including everybody else in that type of forum. I'm also thankful for all of the people that participate in the home advisory councils, county directors for Veterans Affairs, county commissioners, all the 501(c)(3)s, and all the service organizations, especially that are in your counties. Bottom line is we need to do a better job in telling our story. I tell all the veterans organizations that we have a voice, but unless we speak cohesively, nobody's going to listen to us. And why is it so important? Well, the example I give is in relation to veterans issues at the state and federal level. 40, 50 years ago, above 70% of our legislatures were veterans. Now we're down to about 20%. Therefore, we need to get out and not only educate all of you, but people in all of the other agencies in relation to what it is to be a veteran. So, as a private citizen and a veteran, I thank you for speaking on our behalf. God bless you. God bless the Commonwealth. And I'm ready for any questions. Or
Great.
Mr. Hamp is ready for any questions.
Thank you. Tim, did you have questions? No. Chairman?
The adult health daycare center. Have you guys spoken?
Have you guys spoken with Manatoni Manor 3 or 4 miles down the road? Because I think that they would be interested in partnering with you in terms of some sort of a daycare program.
Mm-hmm.
I've talked to them before, and they have an interest. So it's one asset you might want to keep in mind, or a resource.
Copy that. Yes, sir.
Okay. Thank you. Thank you very much for your testimony.
Yeah, let me follow up on Chairman Hennessey's comments about the adult daycare. This is really an important program out there. As this is incorporated, hopefully, into all our veteran state homes. Are you looking at in this? Are you looking at transportation? Exactly how do you approach who you're going to accept and who you're not, and how are we going to get them here and get them home?
Well, actually, we've established a radius. I can't tell you what that is off the top of my head.
Okay.
But anyways, we'll bring in people from within that radius, and it'll be kind of a medical profile for our adult health daycare. We'll be able to go pick them up, bring them here, take care of any needs or issues that they have during the day, not just to have them here to entertain them. I mean, we'll be able to, bring people who are in that type of situation where they actually need supervision and or help. So it's not just going to be a place to, drop your child off, or you know what I mean. It's not like a daycare center in that regard.
Right.
And then at the end of the day, we'll be taking them back home again. We also will receive federal reimbursement for a significant portion of that program. So, we're hoping that it's going to be cost neutral.
Are the feds, I know the feds are putting money into this. Do you see that possibly being an expanding pool of money that will be available to the states for this type of program?
Yes, sir. Yep. In fact, I believe as it exists right now, that's what we're saying, and we think it's going to be cost neutral. They're actually looking at increasing the dollar amount. So, we should be able to, we won't have to scrimp. I mean, it should be mostly total federal reimbursement is.
Yeah, I think there's a savings there in a sense that you're not admitting them full-time into the home here, where they're here for a daycare type situation, and they're going back home to their family, which is, I think, I don't know how you calculate that savings, but I'm pretty sure it's a savings if they can do, kind of like the community care that we do in some of the other programs that I'm sure Tim's more familiar with. But,
sure. Well, actually, what we're doing now within our homes, what we're finding is the preponderance of people that we get in are really. They're in dire straits. They're with us for less than 2 years. But anyways, most of the people require a skilled care setting. We did have personal care throughout all of our homes, but again, the need is more on the skilled care side of the house. Mm-hmm. So we've started reducing the number of personal care beds to increase where the need really is. So I'm not saying that adult health daycare takes the place of personal care.
Right.
But it will help offset that.
Mm-hmm. Great. Chairman Sonato, questions?
No, I just want to thank you for your testimony. I think it was very enlightening. We thank you for your service, sir.
Thank you, sir.
Okay. Let me start with Representative Barbin.
That's okay. Thank you, Mr. Chairman. Thank you, General Weller.
Okay.
Do you expect in the next 10 years that the amount of applications that go to we have the 6 veterans homes, do you expect those to increase based on our 820,000 veterans and our 3.5 million number for the families? Is that do you plan for an increase in population of people that will need to serve?
Mm-hmm. We're assuming that there will be an increased need, and quite frankly, the focus area is probably going to start shifting at some point, where we're going to be getting people that have other issues besides just aging, people that have, the PTSD issues that also require long-term care setting, those types of things. So yeah, we think that number one, the need is going to increase, but then the other thing that we're trying to address is the fact that, we don't serve a lot of the rural areas, especially in central Pennsylvania. Well, actually, the central PA and then along the northern tier. So we're trying to, address all of those types of things, and that's where I talk about, looking for a way to cut costs, but at the same time provide a service. And that might be a partnership with the county homes, or partnership with private care facilities, or just building smaller facilities in those regions.
Well, I only have one comment, and I appreciate your testimony today. This morning, as I was driving in, I was listening to National Public Radio, and one of the stories they had was about the Carson Long Institute, and that did serve as a veterans school, and that their students are now moving to Valley Forge, but they're listing that property for $4 million. And it is located conveniently. I used to live in Perry County. It's right off of New Bloomfield, off of 322. And since we know we're going to have needs, whether they're mental health issue needs or whether they're going to be additional people and they need senior health care needs, we should look at that, because we lost a facility that we could have used with the Scotland School for Veterans Children. And I'm just I'm just asking that you take a look at that facility, because at $4 million, that would seem to be a good expenditure to deal with the long-term problems that we're going to need to address for veterans.
Yes, sir.
Thank you.
That it? Okay, Representative Delissio.
Thank you, Chairman. General, I could chat with you all day.
Yeah, okay. I look forward to it.
In no
Do you have any money?
I'm sorry,
We're going to ask you to keep it to 5 minutes, though.
I'll do better than that. I've worked with Chairman Hennessey. In no particular order, I would urge you to look at these public-private partnerships. I come out of the long-term care field times 30 years, and some of the programs that you talk about are well established on the private sector, so to the degree that you can find ways to work together, learn from someone else's mistakes, layer on what the subset of veteran older adults may need, may help to expedite some of your vision becoming a reality. To that end, I would encourage you, when you talked about networking, there is a 211 system in Pennsylvania, and I was trying to look up on my phone, but I didn't have internet here, to see if that 211 network might actually be a resource for your veteran officers out in the counties who are trying to help disseminate information. So if the 211 system currently doesn't have veteran-specific information, maybe that's something that can be added to that system to help. I would be curious when you mention costs, and that these costs are competitive with or more efficient than the private sector. General, I would be interested in seeing those numbers behind that, because I know I sat at an appropriations hearings a few years back, and that didn't seem to be the case a few years ago, at least for some of the veteran centers. So I would be curious about that. And then in terms of, is there currently a waiting list for the facility-based services, the personal care and the skilled care that's currently offered?
Yes, there is a waiting list. Mostly on the non-veteran side of the house, based on federal, guidance and/or standards. I have to have 75% of my residents have to be a veteran with benefits, I should say. So the other 25%. Generally would be funded either through themselves or with, some form of state funding maybe or whatever. But the bottom line is, in order to drive costs down, we've limited ourselves to 12% non-veterans. So most of the people that you see on our waiting list are what we would call non-veterans. Generally, they're either spouses of veterans, man or woman, or they're what's classified as a veteran without benefits, and that might be a reservist who's never deployed overseas. So veterans have preference, basically, is what I'm trying to get at as far as accessibility to our homes.
And then my last question, has the department ever considered, or does the department have within its resources currently, offer any type of independent living setting for veterans, or a continuing care retirement community type of setting where folks may come in earlier and as a result of your resources remain healthier longer before they may need these other levels of care and services that are more intense and therefore more costly?
Right. We don't have any programs.
Thank you, Mr. Chairman.
Thank you. We've been joined by Chairman Samuelson and also by Representative Costa have come in since we've done introductions. Okay. Next question from Representative Ciccone.
Thank you, Chairman. Thank you, General Weller, for what you do for our veterans. You talked a little bit about telling our story getting the word out. How's our Veterans Registry program doing? I know General Corelli he's a big fan of that. He carries these little cards around with him too. I still carry mine around. He's been an inspiration to me to do that, and when I meet people who don't know about what's going on with our veterans programs, we try to get them into the program. What's the increase been? Have we been doing well with that? Is the program working?
We have, there's approximately 12,000 people signed up, for that program. Obviously, we'd like to see it increase, but and we're trying to think of ways to get that number to increase. I guess, so putting it in perspective, one number that I will say that I see out there, it comes from the federal side of the House. It basically says that about half of the 820,000 veterans in our state, a little bit less than half, are aware of at least the federal benefits, maybe not quite so aware of the state benefits. So the issue's kind of been addressed, but we want to increase our number of 12,000 and get that much higher. So we're trying to think of additional ways to market that program.
So let me suggest to you that we have 203 representatives and 50 senators. They all have web pages. We all have, I bet most of us have veteran service officers in our offices, at least once a month. We can advertise that. We can help advertise that. Some of us already do, I know, but we maybe you should work with our PR section in the House and the Senate to advertise that out, because we reach lots of constituents, and it may help to expand the number that register for that.
Okay.
Thank you.
Yes, sir.
Okay, thank you. Representative Ryan.
Sir, I think in the interest of time, I'll keep a couple of the questions real quick. The other ones I think we can do at the end. General, you and I had talked at a prior hearing about the cost to duplicate what Representative Delissio said, and the reports that I had examined showed that the cost in the state facilities from a labor component were substantially higher than the cost of outside agencies. And the question I was asking is, where are the cost of the facilities shown, the cost of post-retirement benefits, which did not appear from my analysis and from work that I'd done in some reports I'd from the Auditor General staff. It seems as if they are shown different places in the budget, either being absorbed by the federal government. And that's not to say that any of us think that the money could be spent better. I happen to believe that you get an acuity of care that's significantly more complex than most senior facilities see, although Representative Delissio would know better than I. So the question I have for you is I had asked a number of questions at that point about where some of these costs were showing up, so we could really determine what the level of cost structure was, so that those of us who either have an accounting background or a long-term care background could really take a look to make sure that the veterans are being served properly.
Yes, I'm not quite sure how to answer that.
We can do it offline if you prefer, because it's a complicated question.
Actually, I do want to answer the question, though. We publish our costs. I call it the Farmer's Almanac, but what is it called?
Pennsylvania Bulletin.
Pennsylvania Bulletin.
That's it.
Okay, so that's an all-inclusive cost. I mean, that's everything.
That's great.
Now, it doesn't take into account, reimbursements of any type, whether it's state, federal, local, whatever. I'm just telling you what my total cost is. So when we did a cost comparison in relation to, cost data, I mean, we actually got that information, cost data sheets that all of the private care facilities and every facility that has long-term care reports on. And what we found when we looked at that particular sheet was that a lot of costs were not included. I.e. transportation to and from the hospital, cost of a haircut, cost of, I saw you took advantage of that.
Yeah, I got the haircut this morning.
Right. Cost of pharmacy. But the point is, it's a cost. It's a cost to the veteran. So once you start,
Absolutely.
So at first we were comparing apples to oranges, and based on the raw numbers, oh my God, we're twice as much as everybody else. But when you start comparing apples to apples and consider the cost to the veteran, that's where we're actually lower than everybody else. Now, as far as the cost of care, I can tell you that our PPD rates are at 3.8 for dementia-type patients, 3.2 for skilled care, and 1.0 for personal care. That's only direct care workers. That does not include anybody else. That's the CNAs, the LPNs, the RNs. That doesn't include accountants or lawyers or people like me. You know what I mean? Sure. Again, our endeavor was not only to provide a direct apples-to-apples comparison, but also guarantee you that when we say we're providing this level of care, that's exactly what we're doing.
No, in fact, I appreciate that. That's actually some of the things I wanted to get to, is that on the Veterans Affairs side of this, we've had discussions in the past. As an example, when a Pennsylvania National Guardsman deploys, is the federal government really reimbursing us for the full cost? And this is part of the area where I don't believe the federal government is. And that as a result, the reimbursement rates, while they appear to be a reimbursement rate at a standard rate, is certainly well below the cost of care. So as a result, then, Pennsylvania taxpayers are subsidizing it. Concurrent with that, frequently the veteran we're trying to do more and more with less and less, to the point where we're expecting you to do everything with nothing. Right. And so as a result, what I want to really do is sit down, dissect the cost, find out, as an example, there may be problems in the reimbursement rates in the private sector, where I hear that concern on a regular basis in our committee meetings. So I would enjoy working with you, but I would like to go over the questions that I'd asked a number of months ago, because I still think, and Representative Delisi, I'd like to work with you on that, because I've got the accounting end of it. I don't have the long-term care end of it. I just think that there's a component of this that we're missing that's costing a lot more, not in terms of total cost, but in terms of reimbursement from the state vis-a-vis what might be coming back from the federal government.
Right. Well, and part of the issue there is, when I referred to veterans without benefits, actually that's a step in the right direction as far as federal legislation. Previously, those people were not considered veterans at all. And again, I refer to reservists that have not deployed or hold a DD-214 card. So step one was just to get get people to acknowledge them as a veteran. I call them veterans without benefits. So you're right; they don't qualify for benefits, but at least they're known as veterans. So I think step two on the federal side, which I believe some of the legislators are looking to attack, is adding that benefits part onto those people.
Okay, great, thank you. Representative Gill, please.
General Weller, you had mentioned maintenance fees and residence fees, and I was curious as to the trend line. I think you mentioned in your testimony that only 2% of the residents are actually paying the real cost of their care. What is the trend? What has the trend been in terms of their being able to cover cost of care? I'm gathering, since it's at a 2% level, the trend line had to have been down. And do you anticipate a decline over time in a resident's ability to participate in the cost of their care, and how will that affect your budget if indeed the trend line is down? I'm gathering maybe substantially so over time.
I'm not sure the best way to answer the question. I can tell you that on the average, actually in both personal and skilled care, on the average across the board, people pay about $40 per day for their care out of their own pocket. So the remaining amount, either we get reimbursement either through state funding, federal funding, or some other type of insurance. I think that's been holding fairly steady. We keep a close eye on that, though, and what we're trying to do is drive up the federal reimbursements so that we can drive down the cost to the state, if that makes sense. Mm-hmm. So I think in answer to your question, I think we're kind of level on the average of what people in our facilities can pay. At the same time, though, we're trying to drive up the federal reimbursement costs, and the question is, how are we doing that? Well, we're going back and looking at veterans that are currently in our homes, as their health may decline, refile for additional benefits is really what it boils down to. So we're constantly looking, or we're starting to constantly look at their medical records, their medical issues, and the more benefits that we can file for reimbursement on the federal side, the less we pay on the state side. But as far as the average, I would say it's maintained probably the same for about the last 3 years.
Okay, thank you, General. Thank you, Mr. Chairman.
General, what is the federal per diem rate at this point right now? Do you know? The reimbursement rate?
Again, I can only speak in broad numbers, but roughly half of our budget is federal reimbursement.
Okay.
So if my budget,
but you get a per diem per veteran.
Right. Well, each veteran varies.
Okay.
Some may be 100% reimbursement. Others, maybe 50%.
Okay.
It just depends on the veteran.
We're falling behind on our schedule. Can you stay around to the end of the hearing? Or
Yes, sir.
did you have plans to leave?
Okay. My plan.
Great. If you can stay, maybe we can get back. There's several other people who've asked to ask questions, but I'd really like to get to Secretary Osborne.
Yes, sir.
Okay? Thank you.
Yes, sir.
Oops. Thank you, General. Thank you, Rick. Madam Secretary? While the Secretary takes her place at the table, let me just say that it's a pleasure for me to introduce Secretary Teresa Osborne from, I believe, Lackawanna County?
Yes, sir.
Up in the Poconos. We've known Secretary Osborne as the Secretary of Aging and Older Adult Services in Pennsylvania since 2015 at the beginning of the Wolf administration, but many of us on the Aging and Older Adult Services Committee have known Teresa for a much longer period of time than that because of her advocacy in Lackawanna County through the AAA system and I think for some of the senior care centers up there. She's been a strong advocate for our senior population. She's probably going to mention the year 2020. She always works that into her remarks. And it's a significant thing for all of us to remember, the size of our senior population, growing and ever growing. So with that, let me welcome you to Southeast Veterans Center here, and you can begin your testimony whenever you're ready.
Thanks, Chairman. Thank you so much to Chairman Hennessey and Chairman Barrar and Samuelson and Senato. Thank you for the opportunity to be here with you today for what was described in the opening remarks by Chairman Barrar, a landmark joint hearing on programs and assistance for our aging veteran population here in the Commonwealth of Pennsylvania. I'm privileged to serve as the Secretary of Aging and thank Chairman Hennessey for his kind words. Our roots do go back pretty far with regard to my testimony at various hearings when the chairman served as the chair in the Rendell administration with Phyllis Monday at that time, and we had several landmark cases of neglect of care dependent persons that paused the General Assembly to make some enhancements to that law. So that's where our paths first crossed, and I'm ever so grateful and privileged to serve in this role today. As the Secretary for the Pennsylvania Department of Aging, our Department of Aging is formally charged under federal government via the Older Americans Act, which is celebrating its 53rd anniversary this year and is up for reauthorization in 2019. So next year will be an interesting year with regard to the funding that we receive under the Older Americans Act. We're also charged under the Pennsylvania General Assembly's Act 71. And both of those responsibilities, federal and state combined, calls us to be visible and effective advocates for the interests and well-being of all older Pennsylvanians. The Department of Aging was created in 1978, and it serves as the state unit on aging. Every state in the country is required to have a state unit on aging. The structure varies. Pennsylvania historically, since 1978, at least the last 40 years, has had its state unit on aging representing Pennsylvania's aging population, which currently is nearly 3 million people aged 60 years of age and older. And I wasn't prepared to comment on that perfect year, that year of perfect vision, 2020. And by that year of perfect vision, the year 2020, 1 in 4 Pennsylvanians will be aged 60 years of age and older. And in addition to overseeing an array of benefits and services and programs that are made available through our network is comprised of 52 local area agencies on aging that cover the 67 Commonwealth counties of the Commonwealth of Pennsylvania. And through that network of area agencies on aging, we ensure that individuals have access to services and supports. All of you, I know, are familiar with Pennsylvania's Benefits and Rights book for older Pennsylvanians, and it really is a very popular publication that outlines what the benefits and rights are for older Pennsylvanians, including our aging veterans, which I'll talk about in a little bit more detail. But the department, under our charge federally and statewide, we're responsible to represent the Commonwealth's interests in the design, the implementation, and the continuous improvement of long-term services and supports for older Pennsylvanians and across all state agencies. To this end, to Major General Weller's good points that he just raised, it's critical that the Department of Aging works in communication and collaboration and coordination with our sister state agencies. Every day, we recognize that the individuals that we are called to serve include men and women who serve their country. They come home and they often struggle. They struggle to locate and to access home and community-based services for which they are eligible. Moreover, in consideration of the very high number of veterans who are age 60 years and over, and of that 820,000 number that Major General Weller mentioned, nearly half of those are age 65 years of age and older. So it's imperative, critically imperative, that the Department of Aging works in tandem with the Pennsylvania Department of Military and Veterans Affairs in particular in order to connect our growing aging population, our aging veterans and their caregivers with the available resources that will help them live and age well with the dignity and respect that they deserve. Those resources need to be better leveraged via federal services and dollars that are available, as the Major General just spoke about, state programs and services, as well as local via those public-private partnerships with a vast array of Pennsylvania's nonprofit entities, and I'll talk about that a little bit more. But first, I'll comment on Veterans Day 2013, because it was then that the Governor's Advisory Council on Veteran Services was established. It was Pennsylvania's first interagency cooperative approach to veteran services. This council is critical, as Major General Weller mentioned. It's responsible to review, to evaluate, and assess state veterans programs in collaboration with senior staff from all state agencies and commissions. And this approach, this collaborative approach, ensures that information is shared, ensures that program fidelity is met. It coordinates complementary programs and facilitates much more meaningful enhancements in service accessibility to veterans' benefits and services within Pennsylvania. As required under this particular advisory council, I was required to designate a key staff member from the Pennsylvania Department of Aging to serve as my designee. That individual is Samantha Kosman. Samantha currently is the Northwest Pennsylvania Regional Coordinator of the Pennsylvania Department of Aging's Aging and Disability Resource Center. Samantha serves as my designee and is thus responsible to be the key person to communicate with me, to be certain, but also to be a liaison to this commission in order to ensure that the department upholds its responsibility to provide the council with the support, resources, and information necessary in the aging services arena to fulfill its duties. Currently, Ms. Kosman also serves as the co-chair for one of the committees of the council that Major General Weller just talked about, and that is the council's Aging Committee. Ms. Kosman works in partnership with Ed Beck, who is the Chief of Operations for the DMVA's State Veterans Homes, specifically to address the needs of our aging veterans. That opportunity to work collaboratively has been embraced, not just by the Department of Military and Veterans Services, but also the Department of Aging. And that embracement is evident by the efforts and the initiatives that have been launched to better connect Pennsylvania's network of local area agencies on aging, those 52 local area agencies on aging that cover the 67 counties of our Commonwealth, with the Pennsylvania's county directors of Veterans Affairs, all to ensure that Pennsylvania's qualified aging veterans and their families can access needed benefits and services and supports when they need them. To provide you just with the sense of these efforts, I'm pleased to share a few of the following examples. Earlier this year, we launched a survey. The survey survey was conducted of all of our area agency on aging directors, seeking very specific feedback on their current relationship with their local county directors of Veterans Affairs. While the survey was intended to identify gaps and to encourage communication and coordination at the local level, through this survey, best practices were also identified. Those best practices have been captured, and we will be sharing them shortly with the network in order to, via webinars, so that the counties and the regions can learn from one another and to, again, better connect aging veterans and their families to available services and benefits that they may be eligible to receive. This survey also included a question. The question asked our local aging network, our local AAAs, if they were interested in helping the Commonwealth pursue expanding access to the Veterans-Directed Home and Community-Based Services Program. Members of the Aging Committee might be most familiar, but members of the other committee might be as well, with Pennsylvania's current Aging Waiver Program. That program is intended to ensure that individuals can age in place. If they're eligible for medical assistance and eligible for nursing facility level of care, they can receive services and supports in their home as opposed to living in an institution. The Veterans-Directed Home and Community-Based Service Program is a federal program designed to allow veterans who are indeed potential candidates for nursing home placement to receive that care in their homes, their caregivers' homes, or, as Representative Delisio pointed out earlier, in a non-supportive independent living community. The Veterans-Directed Program, this federal program, provides the veteran with a budget and allows them to choose their own care providers in place of receiving care services in the Veterans Administration healthcare system. In some cases, family members of the veteran can be paid for the care which they provide. This Veterans-Directed Home and Community-Based Service Program is presently only available in the Philadelphia, Coatesville, and Erie areas. The survey results yielded that multiple AAAs, which are within a Veterans Integrated Service Network, VISN, also known as a VISN, which indeed these area agencies on aging, many of them were interested in exploring this expansion. At present, thankfully, leadership from the Department of Military and Veterans Affairs is in communication with VISN 4, which is, again, the Veterans Integrated Service Network that Pennsylvania participates in, to determine if VISN 4 will work with Pennsylvania to pursue expanding this federally funded service expansion here for Pennsylvania's aging veterans. Another initiative involved the Pennsylvania Department of Aging's Aging and Disability Resource Center, also known as the PA Link. It was last year our first opportunity, and we're expanding it into this year, that we delivered jointly with Department of Military and Veterans Affairs a Veterans Day message. The message was created in that collaborative opportunity in order to, first and foremost, recognize veterans' military service, to highlight the needs of aging veterans, and to create pathways to better educate and connect our aging veterans and their caregivers to available services which, again, they may be eligible for. In addition, this PA Link partnership, which is very much modeled upon what Major General Weller commented on, as well as Representative Delisio with the 211 system, because through our PA Link leadership, we are currently leading conversations with all types of public and private partners in order to have them register on our PA Link to Community Care website. And most recently, we're engaged in leading conversations with the DMVA and its local county Veterans Assistance offices to create connections with Pennsylvania's two Alzheimer's Association chapters, the Greater Pennsylvania chapter of the Alzheimer's Association and the Delaware Valley chapter, which has a footprint here in particular in southeastern Pennsylvania, in order to either develop or to strengthen partnerships so that Pennsylvania veterans with Alzheimer's disease or other related dementias and their caregivers can be much more quickly linked to the needed support and respite and services that they need and desire. These PA Link partnerships are a critical part of our opportunity to better leverage the resources that are entrusted to our care, and that we better utilize them well and wisely. Lastly, I'd like to comment on the work that is underway to ensure, as the Representative's good question earlier was raised, that the statutory requirements of Act 69 of 2017 are actually met, and that the DMVA is supported and therefore successful in ensuring that its responsibility to ask those seeking services from all state agencies and their agents, and in our case, it's the local area agencies on aging, ask them if they ever served in the United States Armed Forces, and then to help any veteran who desires to be included in the Veterans Registry to register. This exercise under Act 69 will help us to locate every veteran in the Commonwealth in order to provide outreach and information and actually link them with the available services and benefits that they so desperately in many cases need. With guidance from the Governor's Advisory Council on Veterans Services and its Aging Committee, the Aging Network is currently being educated on Act 69 so that we can ensure that at the first point of contact, each caller is being asked if they are a veteran, and if so, they're then educated on the Pennsylvania's Veteran Registry, and support is offered in order to, again, I can't stress enough, ultimately link them to services and benefits that they may be eligible to receive. This opportunity to share some insight into how the Department of Aging strives to support our aging veterans in partnership with the DMVA in particular, but also with all of our sister state agencies is incredibly appreciated. And while exciting things are happening, we recognize that there's so much more that needs to be done. So much more so that our aging veterans and the baby boomers who are coming right behind them are informed, engaged, empowered, supported, and when necessary and needed, protected from all types of abuse, neglect, exploitation, and abandonment. These brave Pennsylvanians who served our country and our Commonwealth frankly deserve, as you all so well know, they deserve nothing less than our best efforts to support their desire to live independently and to age well and healthy in their homes and communities. I look forward to any suggestions that you may have, as well as to answering any questions that you may have as well. Thank you.
Thank you, Madam Secretary. Do you have time for some questions?
Absolutely.
You do? Okay. Let me just begin. I don't have a question for you. Let me just begin by thanking you for mentioning the system of the AAAs across the Commonwealth. That is really the entry-level call, I think, for most of our seniors, whether veterans or not, in terms of trying to access information about what services and programs are available for our senior population across Pennsylvania. And also, you gave a shout-out a minute ago to the Delaware Valley Alzheimer's Association, one of two in Pennsylvania. We members of the House Aging Committee yesterday were down at the University of Pennsylvania, where we heard from the executive director of the Alzheimer's Association with an update on what their efforts are doing or are in terms of doing things to help people who face the trauma, so to speak, of a diagnosis of Alzheimer's disease or some of the related disorders in that field. So thanks for mentioning them. They do fantastic work, as do our AAAs all across the Commonwealth.
Samuel.
We have a question for you from Chairman Samuelson.
Thank you.
So you said that you did a survey of all the area agency and aging directors and all the Veterans Affairs directors around the state to talk about whether they're collaborating. In my county, Northampton County, they're co-located right in the same building, the Human Services building. I guess I'm curious, what did you find? Are they already working together in all the counties that you surveyed?
You know, well, I would wish that there was good relationships and good synergy as you experienced in Northampton County, and that was, by and large, more than half have those good relationships, but there was a good pocket, a good number of folks that said, you know what, there's been a lot of turnover, both at the Area Agency on Aging director side as well as in the county director side for the local county Veterans Outreach Office. And sometimes that turnover then led to not linking up with one another when there was a new director that came into place. So that was one opportunity that we felt we needed to help capture. So we're trying to create those synergies. Others, quite frankly, said that either there's not a good relationship because of personality reasons or differences of philosophy or arguments over funding. So we're trying to break down those barriers and ensure that we can have good, positive relationships across all 67 counties.
And just a follow-up question, you said the Veterans Home and Community-Based Services is only available in Philadelphia, Coatesville, and Erie.
Yes.
Why just those three areas?
It's a federal program, and certainly Major General Weller can answer this probably much better than I can, because I needed to be educated on what exactly this program is in relation to, for example, our own aging waiver program here in the Commonwealth of Pennsylvania, as well as now the implementation of Community Health Choices. But the Veterans-Directed Home and Community-Based Services program comes from the Veterans Health Administration, in particular their Office of Geriatrics and Extended Care, and it must be a partnership with the local local area agency on aging, either in a particular planning and service area or in a particular region, as well as with the VA Medical Center. So it's the VA Medical Centers in Philadelphia and in Erie in particular, in Coatesville, those 3 VA Medical Centers that for many years now have had this veterans program available. We are now in conversation with the leadership of Vision 4. It's being led by DMVA because we have other Pennsylvania counties who line up with the other veterans homes in Pittsburgh, Butler, as well as Lebanon and Wilkes-Barre in order to say, area agencies on aging in those areas are willing to work with them and collaborate with them to expand this program in Pennsylvania. But it does need federal approval in order to have Pennsylvania's desire to expand the program move forward because it is federal funded.
Great. Representative DeLisio.
Thank you, Chairman. Just a comment. The Long-Term Care Council was reconstituted about 2 years ago. The Secretary heads it. I have the privilege of being our caucus's appointee to it. There is a representative from the Department of Military and Veterans Affairs on it to help with some of these linkages. But I'm wondering, our current focus is direct care workers, of which there is a dearth, both on facility-based and community-based programs. And I'm struck by the subsets of older adults in Pennsylvania, one of which is obviously veterans, why we're here today. The other is the intellectually disabled community, which are aging in place, and we haven't a clue. So maybe this is a format, this idea of joint committee meetings, or for the council to look at these various subsets of our aging population, our older citizens in the Commonwealth, to ensure that our broader plan is addressing these subset needs, which are unique to that demographic. Thank you.
I know that wasn't really a question, but if I could just, but I agree with everything you said for many and obvious reasons. And Representative DeLisio, you're a voice at the table that is well appreciated at the Long-Term Care Council. I know Chairman Hennessey is also on that council, and Senator Brooks has a designee, Chloe, who regularly represents her, and Chairman. Whose name now just escapes me, so don't tell him that I forgot his name. Haywood, thank you. Yeah, nobody's going to tell him that, right? We're going to edit that out later. But Chairman Haywood, Liana represents him at the committee. But for our elected officials from the House and the Senate who serve on the Long-Term Care Council, it is deeply appreciated, the insight that you bring. And I'm not just saying that, to earn points with anybody, but it's an incredibly important point that you just that you just brought up, rather, with regard to our Pennsylvania Long-Term Care Council being reconstituted, certainly looking at direct care workers, because if we desire to be a Pennsylvania that enables its citizens to age in place, regardless of age or stage of life, each one of us has the same desire, and that's to live life in our home, in our community, whether that home is the home we raised our kids in, or the home that we downsized to, or the home that we moved into because we felt we needed, a different situation, but to age in place in the setting of our choice for as long as possible. And we can't do that without a direct care workforce that's available, that's accessible, that's respected, that has opportunity to earn life-sustaining, family-sustaining wages. So that is right now a critically important topic of the Long-Term Care Council. We did make sure that we included in that scope, in that space, veterans' homes. And as General Weller pointed out, direct care workers in veterans' home are critically important. Direct care workers for veterans who receive aid and attendance, critically important. So we need to ensure that we're always looking at the direct care workforce. But to your good point, there is a certain subset here that we need to ensure across state agencies that we're looking at homelessness, we're looking at mental health, we're looking and learning from those counties that have treatment courts for veterans, and even using veterans as peers within that space. So I can obviously go on and on and on, and I won't. But it is critically important, and we need to do better in these spaces in order to coordinate and communicate and collaborate and better leverage our resources. So thank you for that.
Great. Secretary Osborne, thank you for your testimony today. You're welcome to stay around. We're going to take some additional questions at the end of the hearing if you have time.
Absolutely.
I think you might have a busy schedule. I'm not sure, but
no
you're
different
welcome to
than
stay.
anybody else's, but
okay,
thank
well,
you.
you can enjoy lunch with us then.
Thank you.
Okay, we're going to call up our next panel. Mr. Bruce Foster, Department Service Officer, Pennsylvania American Legion, Mr. John B. Getz, Jr., State Adjutant, Quartermaster, Pennsylvania State Headquarters, Veterans of Foreign Wars. It's a pleasure, gentlemen, to have you here with us today. Thanks for taking time out of your busy schedule, and you can begin your testimony when you're ready.
All right, thank you. Good morning, Jack. Good morning, and thank you for providing me with an opportunity to present some information to you about the Pennsylvania Department of Veterans of Foreign Wars serves and assists older veterans, their survivors, and in part through the use of Act 66 funds. Pennsylvania VFW service officers outreach to a variety of office locations and events across Pennsylvania, reaching veterans in the majority of the state's 67 counties. Since Pennsylvania's Act 66 grant program was started, our state VFW has utilized grant funds to connect Pennsylvania veterans with well over $200 million in federal benefits. That's an impressive dollar amount, and in return of our investments for these state grant funds is an incredible success story. These federal dollars have also resulted in a tremendous economic impact for Pennsylvania. Many older veterans are living better today because of Act 66. We serve older veterans in offices of legislators, in fixed locations, in many outreach areas in rural Pennsylvania, at events like the Pennsylvania Farm Show, county fairs, military and veterans programs, local patriotic events, and elsewhere. We are here when we hear about the older veteran who cannot travel. VFW service officers contact the aging veteran and offer to make a home visit with them. This means the world to them. We also visit aging surviving spouses of veterans for whom living in the house creates a hardship. Our VFW service officer participates in many public events that honor older veterans. In fact, our hard work to help aging veterans receive the benefit and services that they have earned has resulted in special public presentation being honored being held to honor those veterans now in their twilight years. Through the Veterans of Foreign Wars, service officers work at the VA medical centers and outreach facilities. We connect with the aging population and to initiate thousands of veteran claims and other support measures for them. Our VFW service officers outreach to locations in and close to larger cities has supported many aging minority veterans. One strong example of this is in our Harrisburg office, where a strong percentage of those older veterans coming in for assistance are minorities. VFW service officers interact with the homeless veterans. If there is an aging veteran caught up in homelessness, we are there to help him or her improve their standard of life. In many wooded areas, rural sections of Pennsylvania, you will find VFW service officers combing through the small towns, farming areas, and town gatherings to locate aging veterans. We ask them if they need assistance or if they know of existing programs like death benefits, aid, attendance, and other benefits frequently used by our older citizens. We visit veterans post buildings in many small towns because there are still many World War II veterans and Korea veterans who enjoy hanging out there with each other at the veterans clubs. We also visit nursing homes to educate residents about veteran benefits. You will often find you will also often find us at senior expos and at information fairs sponsored by the state lawmakers to promote our benefits assistance program to senior citizens. VFW service officers frequently meet and follow up with older veterans who before our citizens never knew that they were eligible for any assistance. Yes, there are still many veterans across Pennsylvania who do not know about the VA and about state veteran programs and services. One case study. A World War II veteran came to speak with one of our outreach service officers. He was so hard of hearing that he could not communicate well with a service officer. His son reported that his aging father had become a hermit, virtually staying at home because he could not communicate with others. Our service officer represented the veteran before a VA Board of Appeals, which resulted in the older veteran receiving 100% disability compensation. While many World War II veterans, Korean veterans have passed away, there are still thousands of these and other veterans still living in the Commonwealth. Also, we must consider the generation of veterans following World War II in Korea. The Vietnam War veterans are mostly at least 65 years or old, and many who have, and many beyond the 70-year-old. Due to causing environment conditions that many of these Vietnam veterans served in, one of which was created by Agent Orange use, many of them are aging faster than the general public. Some are passing away well short of the ages reached by World War II veterans and Korean veterans. Therefore, it will not be a stretch to consider that many Vietnam War veterans as personally living in their final decade. The Pennsylvania Veterans of Foreign Wars will continue to outreach to aging veterans, including those who are aging far faster than their predecessors. Also, they know about and can apply for state benefits, services, and benefits. We will continue our successful outreach methods and stay flexible to expand how we meet and assist these valued citizens. To everyone here today, thank you for the opportunity and for your service to our state, and thank you for the Act 66 program support and its continued increasing level of funding.
Thank you. Bruce? Then we'll go to questions.
Okay. Good morning. My name is Bruce Foster. I manage the American Legion's Veteran Outreach Program for Pennsylvania veterans, and on behalf of our State Commander, James Volrath, I'd like to thank you for allowing me the opportunity to discuss Pennsylvania veterans this morning. I'll keep my comments pretty brief. My colleague here from the Veterans of Foreign Wars may have forgot to mention that other organizations such as the American Legion, the Disabled American Veterans, the American Veterans, the Vietnam Veterans of America, and the Military Order of Purple Heart all do veteran outreach across this great state to the best of their abilities and their budgets. You know, I find it fascinating the way the VA calculates our veteran population. But what it tells us in their latest report is that just over a month from now, on September 30th, 2018, our veteran population in Pennsylvania will drop under 800,000 for the first time in over a century. To some, this might seem like a good thing. As we have less veterans to care for, it should cost less, right? However, when I add that over 55% of those 800,000 Pennsylvania veterans are age 65 or older, it might open some eyes that we have some urgency in expanding outreach programs that change lives every single day. If you knew that we had 122,327 veterans who are between the ages of 70 and 74, would that convince you that it's time that we take action now? Or that we have another 74,122 that are between the ages of 75 and 79? Would that be the decider in your mind, or that other, or would it take the 146,000 Pennsylvania veterans who are over the age of 80 to see how urgent our problem really is? Folks, our veterans need long-term health care solutions, home health care, and assisted living. The partnership between the state and the VSO grant program is a proven success story. Data provided by the VA, not coming from us, but proves that. Act 66 does pay for itself many times over in not only revenue, which we talk about a lot, but the savings it generates with medical savings through Medicare and Medicaid. It took us 4 budget years to increase Act 66 funding, and that was after we maintained it stable for 8 years. I want you to consider a simple situation, one that we will all be faced with one day, veterans or non-veterans. And that is that as we age, our need to preserve the resources that we put away while we were working increased greatly. Veterans and their families face this same situation every day. That families struggle with finding resources to care for their parents, their grandparents, and great-grandparents. Veterans are very proud individuals. You often hear them say that they're not looking for a handout, or it should go to somebody who deserves it more, or we don't take charity. But I can tell you from experience, when a few dollars more means the difference between putting a loved one in a private assisted living facility instead of a Medicaid home, nursing home, just by using the benefits they earned by serving their country, now that's a wonderful day. VA pension benefits can help veterans and their spouses live in higher, more independent levels of care for a much longer period of time. You should understand that the VA is the second largest bureaucratic federal agency. It runs by rules, regulations, and laws. Title 38 of the United States Code outlines the benefits and becomes our lesson book as service officers. Internally, the VA uses their M21 and M21 procedure manual to keep its decisions consistent. I tell you this story because it's these same rules, regulations, and laws that make many veterans and their families eligible for benefits. Now, the VA does not go out of its way to advertise that they have money and benefits to give away. Using a trained, accredited representative will ensure success and receipt of the maximum benefits available. The VSO grant program has literally helped thousands of Pennsylvania veterans receive benefits when they need them the most. Every time we enroll a veteran in the VA healthcare system, your state budget should go cha-ching. That's another veteran that we don't have to save Medicaid dollars for. Everyone who we attain service connection for is just another one that you won't have to fund long-term health care for. We support legislation that will increase funding for Act 66 in the most expedient way. We have long supported the idea of using the lottery system as a bill payer for Act 66. We need to know more about the VGT bill before we're ready to commit to it, but the Pennsylvania War Veterans Council will study that idea and hopefully support it when they get back together here in September. In closing, I just want you to consider one more situation.
It's ours.
Imagine how many Vietnam veterans there are in Pennsylvania, or the widows of Vietnam veterans there are in Pennsylvania, whose husbands passed away years ago from what is now considered a presumptive condition related to Agent Orange exposure. Conditions such as respiratory cancers, leukemia, ischemic heart disease, Parkinson's, and widows don't even know that they are eligible for both compensation and health care from the VA, and they're totally unaware of it. I want to thank you for this opportunity to speak this morning and talk about a little bit about our programs, and that's my presentation. Thank you, sir.
Thank you. We're going to get some questions for you.
Okay, cool.
Thank you, Steve. John, Bruce, thank you very much for your testimony to the committee here today. John, you mentioned the Veterans of Foreign Wars Veterans Service Officer, and Bruce, you added the American Legion, the AMVETS, the Military Order, the Purple Heart, Vietnam veterans. They all have, if each of those associations has a VSO, a service officer, and each of the counties, I believe, has a service officer, how do they coordinate? Can you explain the relationship between the county level VSOs, which I'm familiar with? And, when I have veterans come into my office, the first call I make is to Lawrence Davidson saying, what can you do to help this fella?
Sure.
And they're very, and by the way, Lawrence, I'll shout out for him. I say, look, I got a guy who's 85 years old here. I'm not sending him down to Westchester to go try to figure out the government services building down there. It's like sending him to the Pentagon. You come up to my office, and he's very willing to do that and meet in my office with these veterans, and he's helped them significantly. One guy went from like a $300 a month pension to $1,300 a month just by meeting with Lawrence one time.
Happens every day, sir.
Yeah, and so thank you for the work that your groups do. But tell us, if you will, just how they interplay with each other so that we can understand it better.
Okay. First of all, each county in Pennsylvania, all 67 are mandated by the county code to have a county director of Veterans Affairs. And that person's responsibilities are many, but taking care of benefits is one of those responsibilities. But I can tell you that if I can tell you a quick story, I was driving one day through Chambersburg, and it seemed like I was never going to get out of town. I just kept going and going and going and going. And I said to I had just come from the county director's office, and I said to myself, how can a county director take care of the veterans in his capital city? I mean, he's got so many to take care of there. How does he do the veterans outside of his capital city? And but we work with many of the county directors of Veterans Affairs. The York County Director of Veterans Affairs we work exclusively with. Jefferson County, Clearfield County. We work hand in hand with those agencies. We are willing to work with anybody to help veterans. And some county directors see us as a threat to their job, I think. But it's, all we all want to do is help veterans, that's all. So, I don't know if you want to add something, John.
Can I just ask a question before we leave that? Veterans, the county veterans offices exist, but I think they also have what's called a VSO, a Veteran Service Officer. And as I understand it, these people are highly trained and skilled in knowing exactly the programs that the federal government and the state government offer to our veterans. So the county directors are one group of people, but the VSO officers are the ones I think you have to hone in on, because they're the ones that are certified officers who receive the training, know where to point people in the best direction.
The state of Pennsylvania manages its own, manages its own power of attorney, and they provide training and accreditation to the county directors, and I'll let General Weller and his team talk about that. They accredit the county directors of Veterans Affairs. We do the same thing through our veteran service organizations. We all have an accreditation program. We all have a continuing education program. We're continually taking web-based training to improve our skills or a weakness in an area maybe. But I would say that we're subject matter experts on federal benefits, and we're just in addition to the county directors of Veterans Affairs. If you look at it in a total, that is our veteran support system in Pennsylvania. Our county directors of Veterans Affairs and our VSO partners through the Department of Military and Veterans Affairs. And of course, they're doing outreach all the time with their outreach vans to try to get the word out. There are.
Well, Bruce, thank you. I think John wants to jump in here.
I just want to add a couple things. Well, basically, on the VFW side of it, we, in fact, every August, we have 40 hours worth of training that we send to all of our new service officers. When I say new service officers, that's within 5 years of service. After 5 years, we have an advanced training, which we give them another 40 hours worth of training, which is held in the November time frame. And then it's getting that busy that we also have a training now also in the January time frame. So we try and give them at least 40 hours of training. Now also under the state benefits, I have had the Department of Military and Veterans Affairs come to all of our officers and train everybody on state benefits, so they're fluent with them also.
Okay, well, thank you for your testimony, both of you. I just wanted to make sure we weren't duplicating services as opposed to coordinating services. And it sounds like the coordination's happening.
Sir, I can say that we don't have enough service officers in Pennsylvania with our county directors, with the VSO program. We should triple it. That's all I can say.
You're saying the need's there.
Yeah, the need's there, and duplication's not there. The thing is that when you talk competition, yes, there is competition out there with the county directors and even other service organizations sometimes. We try and work well with each other, but we actually have some county directors who won't let us in because we're going in their territory, and then they fight. So we do have that.
Okay. Well, thank you very much for your testimony, both of you.
You bet.
Great. Chairman Sonato.
Thank you, Chairman Hennessey. I just want to thank you. I have the officer come into my office once a month. They're doing a great job. It's a good need. It's a good need in the community, and we get a lot of positive feedback. They do provide very valuable information, so I just wanted to pass that on. Those services are great for our veterans and our community, and that's something I think is a very valuable program. So thank you for your efforts.
The
Chair. Oh, go ahead.
I was just going to say that we've been in your office for a long time, and that's handled by my area office. But you know, we asked each one of our partners, our legislative partners this year, to sign a memorandum of understanding, you know, what we're going to provide, what we expect them to provide. But, you know, basically they provide the space for us, they provide the advertisement, let your constituents know that we're coming. All of our veteran service officers have access to the VA records, and they're limited by power of attorney, but we can set up in any place.
Chairman Samuelson.
Thank you. You talked about the services available all over Pennsylvania.
Right.
How many veteran service officers do you have in the VFW, and how many do you have in the American Legion?
Okay, I have 29 in the VFW, American Legion.
I have 19.
And they're located all different parts of Pennsylvania?
Oh, yeah. Yeah.
Okay.
Yeah.
Yeah, same here. I have offices in Erie, Butler, Altoona, Lock Haven, Harrisburg, Philadelphia, Pittsburgh, Wilkes-Barre, and then we have outreach that runs out through those areas, and also we're in legislators' offices and also clinics and everything else throughout the state.
And has that number been stable the last couple of years, or have you been adding veteran service officers?
What I did, I added, after Act 66 took place, the purpose of the program is outreach. So with that purpose, I tried to hire as many service officers in the state of Pennsylvania so we can get into the rural areas and make sure that the veterans are taken care of.
Between us, you know, we're the largest two organizations that get a piece of pie of the Act 66 budget. But between us, we have kind of a different philosophy of who we hire, and we pay all of our employees' benefits, health care, retirement, all that, where some of the other organizations don't. And so it keeps us at a limited number of people that we can add. John's philosophy is to hire people that he doesn't have to provide benefits to, so he can stretch his dollars farther than I can.
Yeah. Well, one thing, my philosophy is to hire veterans that are retired or on disability. I try to do that, but sometimes the problem with that is if they do have post-traumatic stress and stuff like that, if they sit there and listen to the stories of the veterans coming in, it does create more post-traumatic stress for them.
Okay. Representative Dush.
Thank you, Chairman. Bruce, you brought up Jefferson County, and I'm blessed. Herb Bowler's the county commissioner who's actually in charge of that, works very well with Krupa Steel or VSO. And your people come down. I've got the one from Erie office comes to my Brookville office, and then south of 80, we've got the guy from Pittsburgh comes up to my Punxsutawney office. Right. My question is, you mentioned about some of the conflicts that happen, and Herb has questions from time to time on where the lanes are crossed and where, who's got what. Is there any way of possibly getting a written outline of where those lanes are? Because our people want to work together, and we don't have the competition and the headbutting, fortunately, but we would like to see a little bit so that we aren't bouncing back and forth between offices.
From our perspective, and I'm sure John will agree with this, that from our perspective, we just want to help veterans, okay, wherever they are. And sometimes the county directors, like I say, and I understand it because I used to work for the Department of Military and Veterans Affairs. I used to manage the county directors at some point, and I understand, that they may see competition or whatever. We don't have competition. Well, you know what I'm saying? A veteran is a veteran. We want to help that veteran no matter where that veteran is. So, if I think I'd have to talk to Rick, and if we were going to come up with some kind of a written thing, but the county directors of Veterans Affairs belong to the Pennsylvania War Veterans Council. They belong to the State Veterans Commission. In fact, the current chairman of the State Veterans Commission is a county director of Veterans Affairs. They hold all the cards. So, but we're willing to work with anybody, and like I say, the county directors that we have a direct correlation relationship with are happy. So Jefferson is a longtime American Legion county.
Yes.
They've been working with us for many years. So.
Thank you.
Okay, Representative DeLisio.
Well, I've learned so much this morning.
Good.
Amazing. Gentlemen, two questions. Is there ever an intersection with a prize? So a prize comes out of the Department of Aging, provides highly trained volunteers to help older citizens understand particularly insurance benefits, and I'm wondering if the prize folks are at all familiar with at least making referrals or particularly asking those spouses. You've indicated that there's lots of citizens out there who may not even know they're benefit eligible, and that question may be better directed to the secretary eventually, but if you say what's a prize, then I'll know. And that may be an intersection to help your world move forward. Because a prize is, I think, in every county. I mean, we have an apprised person in our office monthly who has a brisk kind of business, if you will.
I can't say that I'm familiar with that.
Okay.
But I too have learned that many things today.
Well, then this might be one really good concrete definitive outcome that could happen immediately from this Secretary Osborne, because a prize is, I can see some synergy here without anybody stepping out of a lane.
Yeah.
And then your comment, Mr. Foster, that had to do with lottery funds. Is that a pitch for lottery funds, or do you already receive lottery support?
Representative Barrar sponsored a bill to use lottery funds for to fund as a bill payer for Act 66. We have, as the Pennsylvania War Veterans Council, which is made up of all the veteran service organizations, have supported that concept for a long time. And, we have moved, it's kind of like the military. We've kind of moved forward and stepped back and moved forward and stepped back. But, my point of my whole presentation is that we need to, if we're going to help the veterans in Pennsylvania, we need to help them now. We can't wait. We got to find the funding to take care of these veterans, and in turn, I'm telling you, if we studied the impact that veteran benefits have in saving state funds, you would see that it would pay for itself immediately.
Thank you.
Representative Delicio, my legislation, what it does, it would create a special veterans lottery ticket that would be available on certain national holidays that would help to fund Act 66 and also the adult daycare program, where that money then would be targeted. There would only be, I think our legislation creates five days a year. Would it be 5 days? Is that what it reads?
Roughly.
I know we've changed it in the past.
Yeah, it's still.
And then the other thing I have is a VGT bill that would allow for private clubs, the VFW clubs, then to put VGTs in, and then that money would then be available. It would go into the fire department into their private clubs, and also the VFW private clubs. That again, that revenue would be used for additional upkeep for their facilities. It would go to Act 66 and also for other programs, other veteran programs, depending on, of course, how much money it could make. Okay, but the expansion of Act 66 is very important to these gentlemen. Okay, Representative White.
Earlier, we were discussing, the overlap of the areas that you are in and the county persons that are taking care of our veterans. And the gentleman who works in my office, he had mentioned at one point or another, I believe, that there's sort of like this competition, and the reason for it is because it's based on volume, like the number of veterans that are served. Is there any truth to that, or why is there competition? In other words, why is there that
Yeah. There is no such thing as competition.
I agree.
Yeah. I mean, if John and I compete for a piece of the Act 66 puzzle, I mean, the funding, okay? If you looked at it in a pie situation, he wants a portion of the pie, we want a portion of the pie, just to do what we do. But there's no competition between us. We're not trying to outdo each other or anything like that. I'll let John comment on.
We just try and make sure everybody serves in the state of Pennsylvania. That's what we're here for. We're here to make sure that there is competition out there, okay, again, territorial and stuff like that, like I said before, in some of the counties.
Right, that's what I was getting at. Why is there that,
Because
you
I
know,
think they're
relationship there? What's taking place that maybe we can help to rectify?
I think the county, okay, I don't know, but I think some of the counties that I've been watching that have that direct competition with our service officers, I think they're in fear of their job. I think they're in fear of what they're doing, that we're taking over their area, which...
That you're doing it better?
You have to understand,
Okay.
we have very good people out there, and they're excellent at what they do, and they do pull the veterans in. So, and I think that's some of the stuff.
Is it because right now the pot of money for Act 66 is $2.8 million?
Right.
Do the county directors get part of that 2. Nothing?
No.
Do any of their employees, so they get nothing out of the 2.8 million that is allotted by the state budget?
That $2.8 million is our agreement between us.
Okay. I thought maybe that's why there was some maybe hostility or pushback from the county offices.
I can explain it probably this way, okay? And that is that every county has a county budget. And you have commissioners that manage the county budget. And many times a commissioner will say, oh, maybe I don't need a full-time county director. I'm required by the county code to have one, but maybe I don't need a full-time director. Maybe I could just hire a part-time director because the VFW is coming to my town on this day and the American Legion is coming on this day. And, we have no control over that. But I think that's where the animosity starts, that people... county directors might see if the more outreach we do in their county, the more the commissioners might say, maybe we'll save some dollars here.
Okay.
And
very quick. Okay.
You're jumping in?
Yeah, if I can.
Yeah.
Just to comment further on the ticket, so you understand, the lottery started 45, 46 years ago in Pennsylvania on the promise that its funds would be dedicated to the needs of senior citizens, not all veterans, but to senior citizens. New Jersey dedicates its to education uses. Pennsylvania, though, was created the lottery with the promise to serve senior citizens. What we've been working out are the details in terms of how to take the lottery, a veteran's lottery ticket that Steve's promoting, and make sure that the programs that are funded by that kind of the purchase of those tickets are dedicated to veterans who are 60 and over to meet the definition and to live within the parameters of our statute that created the lottery in Pennsylvania in the first place. So that's the tug of war that's been going on. It's not anything, and no animosity with regard to be directed toward veterans, just to make sure that we live within the parameters of existing law.
No, we understand that. And if let's say that the lottery system, let's say we did use the lottery system for Act 66 funding, it would be up to us to write a program of how to use those additional dollars to strictly support those 55% of our 800,000 veterans that are over the age of 65, or the age of 60.
60 in Pennsylvania.
Yeah, 60 in Pennsylvania. So,
okay. So we're on the same track.
Oh, yeah.
And we are making progress.
Yeah, and if there's anything that we can contribute to that, as far as the planning, we would be more than happy to do that.
Okay, thank you.
You bet.
There's certainly no shortage of veterans over the age of 60 that we can help.
That's exactly right.
Next question, Representative Fritz.
Thank you, Mr. Chairman. There has been a very clear theme today, and that is one of partnerships, and we see it with the VA, we see it with our state, as well at the county level through our AAAs and our veteran directors, and as well the American Legion and the VFW. So I want to speak to that a little bit. And here's the theme. I do host a service officer in both of my legislative offices, and oftentimes I will interact with that veteran on his way out, and this will be his response. I never knew. And we speak to that, one of our testifiers presented that half of our veterans are unaware of some of the benefits that they are entitled to. So in looking at the partnerships, I'm wondering if there's, and this is an idea, if there's an additional partner that perhaps we're overlooking here, and that would be the AARP. They are a nonprofit organization, and they very much have a theme of eradicating poverty. So I think that perhaps they could provide a forum, and they have the outreach ability to perhaps disseminate some of this information. And again, that follows on some of our partnership themes, and especially the public-private. So just wanted to bring that idea forward. Thank you.
Thank you.
Can I comment on that?
Yes, go
just
ahead.
one comment, and that is that the AARP, at least their representation at the Capitol, had led us to believe that they would support the lottery bill. I think that's important because of their outreach. So.
Well, thank you for the suggestion, John. That's really a very good suggestion for us all to think about.
One more. Last questioner is Representative Ryan.
I'd like to add some clarity to the testimony you already heard today. This is a burning issue. These gentlemen represent an organization, and by full disclosure, I am a life member of the one. And the VSOs perform an invaluable service, but I think we need to know why that is, and the questions we're trying to get at that today. If everyone is in charge, no one is in charge in reality, and the VSOs provide that link across the board. We have operational seams that are absolutely horrific for what a veteran has to do to jump through. Chairman, you had a booklet that you had presented, and Sean and Rick will tell you that I saw it, and I said this is probably the best one I'd ever seen. I was a branch head at the Manpower and Reserve Affairs at Headquarters Marine Corps for 3 years prior to deploying to Afghanistan and Iraq. And I can assure you that that booklet will do more to help with the operational seams than you can imagine. If these gentlemen's VSOs were not doing what they were doing, you would be seeing complaints of unparalleled proportion in your district offices. We're getting them now. I have a fully disabled Silver Star recipient in my district, Purple Heart recipient, former county commissioner, that was told that his injuries were not service-related and connected after he had been getting disability payments for 35 years. VSO stepped in and helped. We have to realize that when you've got county, state, and local governments interacting with the federal government, and there might be 50 different touch points, that no one's going to know all the details. These organizations do. We need to do everything we possibly can to knock down these operational seams, because until we do, veterans will not be served.
Thank you. And Bruce, you know how I feel about this program. Bruce and John, it's just, we have it in our office. We have the Veteran Service Officer. He does a fantastic job. I get so many compliments on this program. I'll tell you what, I think these are some of the best dollars that we spend in state government is this Act 66 program. So everything we can do to help you, we're hoping that we can get you additional funding so we can continue to expand this.
Thank you.
Okay. Thank you, gentlemen, and thank you for taking time out of your schedule to be with us today.
Thank you very much.
Our final panelist is Mr. Bob Singalese. Oh, wow. Did I say it right?
Pretty good.
Okay, cool. I'm looking at it, and I had to figure it out. So, Territory Manager for Veteran Home Care, New York, what is it, New York, Jersey, LCC, it's, okay. Hey, pleasure to have you. I'm trying to figure out what the last initials
no
are.
problem.
NYJ?
It's Singalese, first off. But you did very well. You did very well. Thank you. Yes.
I just want to say before I even get started, thank you very much for inviting me here, for allowing me to present Veterans Home Care to you, especially after the last two testimonies. You actually stole some of my thunder, actually, on some of them. Our mission with Veterans Home Care, as we see, is to assist our veterans who protected our family and to stay in their homes and live with dignity. And listening to the last two testimonies, I really believe that Veterans Home Care could be one of the solutions. So to introduce myself, I am Bob Singalisi. I am the Territory Manager for the East Region of Veterans Home Care, LLC. I am not a veteran. However, I am in awe of all of you who have served for our country. And I've been in many homes since joining Veterans Home Care and listening to the veterans and helping our veterans and surviving spouses. So I'm also not a lawyer, and I am also not a financial advisor. So I am a territory manager, as I said. We are a private, for-profit company that was started back in 2003 from our founder, Bonnie Laderman. Bonnie's picture is in your packet there. This is Bonnie in our packet. And how Veterans Home Care got started was Bonnie's mother, unfortunately, had breast cancer. Bonnie's mother lived in St. Louis, Missouri. I'm sorry, Bonnie's mother lived in Florida, and Bonnie lived in St. Louis, Missouri. So when Bonnie found out that her mother had breast cancer, she became a caregiver for her mother. And once a month, she would travel from St. Louis to Florida to help her ailing mother. Well, this got to be obviously overwhelming for her. And through research, she found out that through the VA, the Veteran Affairs, they had a little-known pension known as aid in attendance. Now, Bonnie's father was a Korean War veteran who had passed away. So when she learned about this pension, she found out that her mother could be eligible for this pension to get the money, as we were just talking about with testimonies, to help her stay in the home and have that money pay for our health care benefits. Well, unfortunately, Bonnie's mother did pass away before the benefit was awarded to her. Hence, that's how Veterans Home Care came about. Her whole mission of starting Veterans Home Care was to educate the public. I've heard many times now from our veterans. I have spoke in front of over 200 veterans that don't know about this benefit. They don't know about any of the benefits that they are awarded with or that they are entitled to. So this is something that is strictly our mission, is to help the veteran, educate the public, educate the healthcare industry of the benefits that our veterans are entitled to and their surviving spouse. With the benefit of aid and attendance, this is the only benefit that we deal with the veteran. If it's something else related to veteran benefits, we then refer them to the county or the state VSO. So we're only dealing with the aid and attendance pension. So what we do is this, okay? This is a means-based benefit. They have to qualify for this benefit. Our job is to make sure that they do qualify for this benefit, and it goes by what we call the 3 M's. And everybody has in their packet a little card here. And part of the requirements for the aid and attendance benefit is that the first one is military, that our veteran must have at least 1 day of active duty in a wartime period. They have to have 90 days of total active duty, and they have to have an honorable discharge. Our second qualification is medical. So part of the requirements for the veteran or the surviving spouse is that they need help. They need help with the basic ADLs, activities of daily living, that they can't be driving, that they need help with preparing of meals, that they need help in hygiene. And this must be signed off by a medical doctor, not a VA medical doctor. Their medical doctor has to sign off on this. The last part is money. Money is always the one that will probably disqualify most of our veterans or surviving spouses, is because if their income is too high or they have too many assets, they're not going to qualify for this benefit. If that's the case, then we refer them to their county VSO, or we will refer them to some other health care provider that can help them. So now this is where Veterans Home Care comes in. We offer what we call the exclusive Vet Assist program. We determine if the veteran or surviving spouse qualifies for the aid and attendance pension. We then guide them to send us the necessary documents that they need for the VA application. And if you can see back on the card, it shows you all the documents that we need. Once we get all the documents for the application, we actually go to their home. We sit down. This is the part that I am in awe of, because we go to their home, we sit down with them, we fill out the VA application with them, we make sure that they're qualified, everything is verified, and then we help them fill out the application. We then take it back, and then we upload it to the VA. Here's where we come in. Once we send the application to the VA, it can take anywhere from 4 to 8 months for the VA to approve the application. While the application is pending, Veterans Home Care will offer them a zero-interest loan while the application is pending, so they could start their home care or adult daycare right away. Now, we know we have a 98% accuracy when we send in the application. And this is something that I didn't put into my remarks, if the VA denies the application of the aid and attendance, and they deny it based on a medical reason, any money that we've laid out for the home care, they do not have to pay us back. And that's in black and white. However, if they get denied because the VA has found more money than what they have disclosed on the application, then of course they would have to pay us back. And a quick story about that is that I signed up, one of my first cases that I signed up was a 95-year-old World War II veteran. He was living with his son and his daughter-in-law, and we signed them up for the home care. And we uploaded the application, and about 2 weeks later, 3 weeks later, we get a call from the daughter-in-law. Now, I don't know if anybody here has heard the term strong box, but a strong box is more or less where you would put important papers or money. And this veteran, we found out, had savings bonds that accumulated to $250,000. So he did not qualify anymore for the benefit. So, but I just thought, I mean, you know, listen, it happens. Sometimes the veteran or the surviving spouse, they have money that they don't tell their children about. So, and then it just comes out later on. But I just thought that was pretty cute. So once we send in the application, like I said, we offer them a zero-interest loan so they could get started right away with the home care. They don't have to wait for the VA's money. And then once the VA does award them the money is retroactive from the time that we met with them, and that money will pay back my company's money, the money that we've laid out for the home care. As I said before, we are a for-profit company. How Veterans Home Care makes their money is that we have providers all throughout the country. We service 44 states. So we have providers, home care providers, adult daycare providers that we have agreements with. We ask them to take a discount on their private pay rate. We put in our small markup. We make the spread. We make anywhere between $6 to $8 an hour on every case that we sign up. And we make our money on volume. Now, there's no out-of-cost pocket to the veteran or the surviving spouse. If you look at the card that I presented to you, you'll see the amounts of the aid and attendance that they could qualify for. We convert that into our hourly rates. If they go over, let's use a surviving spouse, for example. You'll see a surviving spouse, they get $1,176. That would turn into 42 hours a month of home care. If they go over that, they will pay out of pocket to the provider directly whatever the provider will charge them. But for the first 42 hours, the VA benefit will pay for it. That's really about all I have on how we do what we do. My thing is to work with the county VSOs. I am, if you haven't known by now from my Jersey accent, I am from New Jersey, and we have representatives all over Pennsylvania as well. We have 3 full-time reps that cover Philadelphia, Pittsburgh, and Harrisburg, so we have covered the state. We probably need more regional managers, but just listening to you gentlemen and this nice young lady, with their testimony and working with the VSOs, it's just something that I know I want to do more of. I believe that veterans home care could be part of the solution to help our aging veterans. And again, I want to thank you, sir, for giving me the opportunity to present my company to you. And I'm obviously open for questions. Thank you.
Anybody have questions for the testifier? Steve, Chairman.
So when you do the zero interest loan, when they get the retroactive check, that's to pay back the loan?
That is correct.
Okay.
That is correct.
When they get a monthly benefit, are they getting the full monthly benefit, or you don't take a percentage of?
Always the monthly benefit.
Okay.
The full monthly benefit.
Great. And the last question is, when they get this benefit from the VA, they're able to use it for many different kinds of health care. Is that correct?
That is correct.
You only are able to make money for your company when they sign up for certain providers. Do you try to get the people you help to sign up for your providers, or do the folks know that they're eligible to use that money for other services?
Before we go into the home, that's a fantastic question. Before we go into the home, before any of that starts, we educate them that they could do this on their own, that they could go to the VA, that they could qualify for the pension and do it on their own. And plus, they could use that money not just for home care or adult daycare, they could use it for other medical expenses. So they are fully aware of that. More times than not, they don't want to deal with that, so they bring us in. If they sign up with Veterans Home Care, that money, and they have to sign the agreement, that money is only to be used for either home care or adult daycare. But they are aware that they could use it for other purposes if they go on their own.
Home care or adult daycare at one of the facilities that you guys have a business relationship with?
Correct. And if we don't, we will get them. I mean, we've never been turned away from a provider or adult daycare.
How long is that commitment? If a veteran signs up and then decides 2 months later they want to keep getting the benefit but use it for other healthcare related things, has your company locked them into a certain period of time with your provider?
It's just yesterday, we are overhauling that. It was a 1-year agreement, but now it's going to be probably just until we get paid back our loan.
Just the initial startup period?
That's it. And then if they want to leave us, they can, and they could use the money for anything they need in the medical expenses.
And they're aware that they can leave because of?
Absolutely.
The initial conversation or some ongoing?
The initial conversation. Everything happens before we go into the home.
Okay.
Like, we don't enter the home until they have that understanding that they're using the funds with Veterans Home Care for home care or adult daycare, and that they can leave us to use it for other medical expenses.
Okay. Thanks for the information.
Representative Gillen.
Yeah, thank you very much, Bob.
Yeah, no problem.
Just a diagnostic question. Do you encourage the veterans or their families to share bank account information and draw down on that?
Yeah, no. Remember what I just said? I'm not a financial advisor. So what happens is if we know that they're over on assets, we do have agreements with elder law attorneys and financial advisors, and we will give them those phone numbers, that information.
Okay.
I don't have the expertise to do that.
You don't have the expertise, I'm sorry, to what?
To tell them how to spend down their money.
Okay, so there's no sharing of account information with any of...
No, there is
your
at the
other
time of application, sure.
Oh, bank account information.
Oh, yeah. They have to, not just bank accounts, and everything, IRAs, stocks, bonds, all that. Any liquid assets.
Okay, and is that bank account information shared with other agencies or for-profits that you work with?
No, none whatsoever, just us.
Okay. What is the net income of the company overall, and how many states are you in?
We are in 44 states.
Okay.
When you say the net income of them, you mean?
The aggregate, yeah.
Yeah, I mean, it really depends. And a great guide for me that I use is like when you look at the amount of the benefit that they apply for, if they're making anywhere from $1,000 to $1,500 over that amount, they'll probably qualify.
Okay, so you don't have any information on the net income of the corporation?
Of my company, you mean?
Yeah.
Oh, I'm sorry. Yeah, it's a private company. All right, I'm sorry. I misunderstood your question. Yeah, I don't have that. I mean, it is a private company. I'm not aware of, I mean, I can only guess what it is. Last year, I know our revenue was over $30 million, but I don't know what our net was.
Okay. Final question. Sometimes there's controversy relative to veterans organizations and executive compensation. Do you have any information about executive compensation at your company?
No, I do not. None whatsoever.
Thank you. Thank you, Mr. Chairman.
Thank you. Any other questions for this? Go ahead, Chairman.
Thank you, Mr. Chairman. Bob, I'm a little confused. I thought that you said that once they exceed this benefits around, then the company will bill them directly for the additional home care services or adult daycare services. But then in answer to Steve's question, I get the impression that this benefit is like a check that comes to them and they pay for the first 42 hours of service out of that.
That is correct.
So this is a direct check coming to the veteran or his spouse.
That is correct. It goes directly into their account.
Okay.
So let's use a surviving spouse for example. Again, if they it will come out to 42 hours a month of home care. So the $1176 will go to them. Then they pay us. Okay, they pay us. Now let's say they need 60 hours a month of home care. The 18 hours is billed directly from the provider who's doing the home care to the veteran or the surviving spouse. So for the additional 18 hours, they're paying out of pocket to the provider directly.
Okay, and for the first 42 hours, they're paying out of pocket.
Well, they're using the benefit.
Funded by this benefit.
That is correct.
Okay, and then what happens when the rates change, the rate per hourly rate?
No, they're locked in. They don't change their rates. I mean, whatever the rate is that they sign up, that's what they get. If anything, they're going to get more money from the VA if they increase the benefit. But whatever rate that they lock into, that's the rate is for forever.
Forever. Okay. Thank you very much.
Yeah, no problem.
Thank you. Do you have any competitors in this field?
If you ask Bonnie Lederman, the answer is no. But there are other companies out there that do what we do. However, we are the only company that has, and we call it boots on ground, we are the only company that goes to their home and sits down with them to go over the whole VA application and all the other documents that we need.
And my other question would be, like, we have this problem with emergency, with our EMSs. So if the check goes to the person.
That is correct.
And they decide, hey, I'm going to use that money somewhere else. I'm not paying you this month. Do you have any problems with that? What happens?
Less than 1%, thank God. But yes, I mean, it does happen.
Yeah. Okay. Thank you.
Representative Duff, that'll be your last.
Just a quick question. I know you said you didn't have information on the executive salaries, but for example, someone like yourself who goes out and into the field, it's got to take a significant amount of money with travel expenses and wages and stuff like that. I'd be interested, what's the typical wage or salary for someone like yourself, and how in the world, if you're not taking, I mean, that $8 an hour doesn't seem like it's going to cover it.
And I hear you. You know, we've been in business since 2003. So we've helped over 14,000. We're climbing up to 15,000 veteran families. A representative, somebody like myself, starts anywhere from $40,000 to $60,000 a year based on their expertise.
Should have opened the service offices, don't find out.
Thank you.
You're welcome.
Great. There's no other questions. Thank you for your testimony today.
Thank you.
We appreciate
Thank
it.
you for very, very much.
Okay. We have just a couple more minutes. I didn't know there were a couple people who didn't get to ask questions of General Weller. Are they still interested? Was there anyone that didn't get their question answered? If not, Martina? Okay. General, do you want to, why don't you just grab a microphone? You can just stay
General.
there.
Yeah, that's fine. You can stay
Represent
there. That's fine.
Try to wrap this up real quick.
Got it, boss. No problem. I will, my quick question is really just to find out, are there any efforts to encourage local hospitals and other type of medical facilities when they take in patients to actually ask those questions? Because it sounded like it was pretty successful from what you were doing, but then maybe, you know, with your relations into the communities, can we build that up and get more information so that it can be put into our state database of veterans?
I'm not quite sure how to answer that. I don't know if I actually have the answer. I know that there are efforts in that regard. Actually, do you know of anything formal?
Or even like a formal training for hospitals to take advantage of from the state level so that they can make sure that an individual within their hospital or their medical facility, even just local doctors' offices, they can make sure that the people at the front desk, when they have individuals coming in, that they're asking the question, are you a veteran? You know, and then we can make sure that that's being captured and we can, you know, get to them more easily.
You know, it's an excellent suggestion, and part of our opportunity with the survey that I mentioned that we did is where there's gaps, and that is an identified gap in terms of that, and this needs to happen at the local level. So at the local level, you know your community partners best at the local level, including your hospitals, and those hospital case managers and discharge planners who every day, and pretty much in crisis mode, because everybody waits till Friday at 4, physicians to discharge folks, so there's no doctors here, right? Yeah. I mean, that is an issue, but to your good suggestion, that is part of the survey process of a gap that we've identified. So working with our aging network providers, with our partners at the DMVA, with the Hospital Association of Pennsylvania, and AARP was an excellent suggestion too that was made before. All of those collaborative efforts are occurring so that folks are aware of the registry, and folks then know where to point a veteran to receive the services that they're not receiving, for which they say the good answer of, I didn't know that was available. Most older Pennsylvanians don't know the array of services and supports that are available to them, and we need to do a better job of educating them, and also those who help them, all of those points of entry. Great, it's a great suggestion, though. Thank you.
Can I? If I can add, the Nursing Association in Pennsylvania has a program, it's called Just Ask. And I believe that's the title, if I remember right. But it's a triage question. Are you a veteran? Because if a veteran comes in and they ask, are you a veteran? And the person said, yes, I served in Vietnam. You know, they can think of the Agent Orange presumptive conditions, and you know, it's a great program, and it should be expanded.
Mm-hmm. Thank you. Was there anybody else have a question? Okay, great. Just for closing remarks, I'll tell you what, I heard several people say that they've learned a lot. I think the whole committee from both sides, from both different committees, have learned a lot today about the different programs out there. We thank you for your excellent testimony today and taking time to be here with us, and truly appreciate your presence. Chairman Hennessey, anything? Any of the other chairmen? Yes.
No, just let me say thank you very much for your attendance here today. I think we all learned a lot, and when we're learning something that we can pass on to our veterans to help them make their lives easier in return for the sacrifices they made for our country, you know, I think we're doing a good job. It's a good day. Thank you.
Chairman Sinato?
I, too, just want to echo Chairman Barrar, Chairman Hennessey's comments. I thank you. I learned today. I think all of our members learned something. And when you put both of these committees together, our interests are all the same, whether veterans or senior citizens. And it was a pleasure hearing from each and every one of you, and we're going to continue to move forward on our efforts. So thank you for the testifiers, and thank the members for their questions and for coming here today.
Commandant Coleman, we're yours now. So this hearing is adjourned. What's that? Oh, Steve, did you want to say something? I'm sorry, I thought you said you didn't have. Okay, I apologize. Okay.
Thank you.